Hi, my name is Nurulaniza Azman with matrix number 65129. Today our group will be discussing about education and relationship in healthcare. Before we go further in this topic, let me define you what is education and healthcare. Education is a social institution that includes both formal and informal means of transmitting knowledge, attitudes, beliefs, values, norms, and skills. There are many types of education, which are primary, secondary, tertiary, and compensatory education. Meanwhile, education in Malaysia is overseen by Ministry of Education in Malaysia. Education system is divided into preschool education, primary school education, secondary school education, post-secondary school education, and tertiary education, which further divided into national and private education. On the other hand, healthcare is the maintenance of improvement of health via the prevention, diagnosis, treatment, recovery, or cure diseases and illness. Healthcare is delivered by health professionals and allied health fields. Healthcare in Malaysia is mainly under the Ministry of Health. Generally, has an efficient, widespread system of healthcare operating both government and coexisting private healthcare system. When we step back and look, we might be wondering how in the world any of this applies to medicine. You might say it has nothing to do with the physical health of person, so why do social theories and structure matters to someone in the field of medicine? Let's go through the different theories and figure this out. First of all, we have functionalism. It is a theory that differentiates institutions in the society, adjusts to minor changes to keep the society stable and functioning. So, how this is related to the healthcare? If we look in society from a functionalist point of view, when people become ill, medicine ensures that they return to functional state so that they can contribute back to the society. Moving to the next theory, conflict theory. How do the conflict theory in a society affect the health of an individual? As we know, conflict theory is all about the inequality between different groups. In healthcare, this is quite significant impact on who has access to medical care, meaning both can access to hospital and the ability to be recovered. However, wealthier citizens can pay for the best medical care, but people who are scraping by cannot afford hospital bills, so they skip the hospital visits and try to heal on their own. This unequal access to valuable resources in society, like education, lead to limited access to medical care.
It's safe to say that it is indeed a case for the healthcare system in Malaysia. Many people in Malaysia have low income and often they don't have enough financial capabilities to get treatments. But as for people who have a higher income can go to private clinics and get better treatment. Public hospitals in Malaysia are cheap, but patients need to wait for a long time to get treatment, and sometimes the public hospital doesn't have proper treatments and patients stay undiagnosed. To fix this, government needs to take a step and upgrade public hospital services, thus improve the healthcare system of Malaysia.
Good day, my name is I'm from Group 1 and I will be presenting how education influences healthcare in Malaysia. Education is really important in building skill, knowledge, and attitude, especially among medical students or healthcare workers. From nursing to the perspective, one should have a desire to learn, caring, leadership, and well-organized characteristics to be a professional nurse. This can only develop by education. One of the functions of education is for social integration. Person in 1968 describes the profession of learning itself, which has the two main functions of learning through research and scholarship and transmitting the learning to others. It shows that the people who has medical education degree or higher level of education have wide opportunity to work at hospital or any healthcare facilities. By education, many professional healthcare workers can be developed to meet high demand of employees in the hospital or clinics, increase the quantity and quality of healthcare system, and provide the best service to the patient. For example, during this pandemic of COVID-19 in Malaysia, every hospital and healthcare setting with numbers of healthcare workers, doctors, nurses, medical assistants, and others. It shows that education is really important in developing sufficient amount of professional healthcare workers in hospital or clinics to give the best service and treat higher number COVID-19 patients every day. To conclude my part, education plays the main role in developing professional healthcare workers in order to build the best healthcare system in Malaysia. That's all from my part. I will pass to the next presenter to explain the other points for this topic. Thank you.
Hello, my name is Amarina binti Ibrahim and my matrix number is 73332. Education can create opportunity for a better health. According to new study, lifespan could be extended up to 2 years by reading books, and the more often you read, it is more better. Based on Harvard Medical School and Harvard University's new finding, it shows that individuals with more than 12 years of education have notable longer life expectancy than those who never went beyond high school. In addition, there are also findings about damaging to a person's life, such as smoking cigarettes, also because of failing to obtain a higher education. One of the benefits for being an educated people is involved in social networking. Reading can help us to get access and understand the information. Higher education people feel like they have better ability to deal with difficulty because they have many cognitive skills which can help in manage the complicated situation. To give an idea, we can see what happened during this pandemic situation. Education is a bigger factor in desire for COVID-19 vaccine. People with higher education more likely believe in the safety and the effectiveness of COVID-19 vaccination compared to people who are only heard through rumors through the social media.
A very good morning to everyone, especially to Associate Professor Dr. Manfred, our course coordinator for MDJ1632 Social Sciences. Now it's my turn to explain one of the examples of our discussion, which is, does education influence healthcare in Malaysia? Does the education influence the healthcare in Malaysia? In my point of view, yes. Education influences the healthcare in Malaysia because education could increase public awareness in rural area about healthcare. This could increase awareness among the rural residents about the most infectious diseases. This is because rural resident has low level of education as well as low standard of healthcare. Other than that, the ignorance of the indigenous people on the importance of medical facilities provided in the village by the local government. In Malaysia, orang asli Jakun is one of the example of rural residents. As previous study, in Fix 1995 by Nicholas 2006, more than half of the present days, they have been relocated to areas very much farther from their old settlements, which is in the forest. In studies Fix 1995 by Salbia 2012, to them the forest is the source of food as well as health remedies. In the time of illness, they prefer to go to the clinic nearby because they do not have accessibility to the forest product as they move out from the jungle. Study on Chinese school kids in Lijiang City in Hunan province in China shows that when the students' awareness on soil transmitted helminths rose due to, and there appeared to be a shift in pupils' behavior in terms of hand washing on a regular basis as a result of good education. There is also a study on orang asli Lano living in Lenggong, Perak, conducted by Cheng et al. 2014, which highlighted the urgent need for education intervention to increase the Lano community's awareness of correct medication use. Thus, with health education, it promotes understanding on transmission of diseases, which bring about behavioral change that reduce such transmission.
Hello guys, my name is Alprani Murusalim with matrix number 73328. Undeniably, education does improve healthcare system in Malaysia and also positively impact Malaysians. Having said that, education indeed the most powerful weapon for developmental in all aspects. Thus, in order to improve personal lives, to help the society run smoothly, and even to have a country that have excellent healthcare system, people need to be educated. In other words, people have to gain more knowledge and stop being ignorant, even though health is not their measure. Since nowadays, people are always on the social media, I think online platform is the best medium to launch the campaign of importance of education in healthcare. Isn't it even more easier to get people's attention in health awareness campaigns if people are well educated?